Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today I'll talk about lung cancer, which claims over 127,000 lives in the United States each year. Lung cancer has also been in the news recently after the passing of beloved actor Andre Braugher, who played Captain Holt on Brooklyn Nine-Nine. The highly respected actor died on December 11th at age 61 after being diagnosed with lung cancer just a few months prior to his death. As a physician who has diagnosed and cared for many patients with lung cancer and whose close friend's mother died in her 40s from lung cancer, having never smoked, this disease holds both professional and personal significance. The most common symptoms of lung cancer include a persistent cough, bronchitis or pneumonia, coughing up blood, chest pain that's worse with deep breathing, hoarseness, shortness of breath, and unexplained weight loss, as well as other symptoms. In today's episode, I'll discuss 5 things you need to know about lung cancer. You could save a life. Let's get started. Fact number 1. There are 2 main types of lung cancer: small cell lung cancer and non-small cell lung cancer. Non-small cell lung cancer is the most common type, comprising 80 to 85% of cases. Small cell lung cancer accounts for only 10 to 15% of lung cancer cases, but grows more quickly and is harder to treat. How can you tell the difference? Doctors use histology by first obtaining lung tissue from a biopsy and then analyzing the tissue under a microscope. The pathologist will then determine if the cells look flat and round, like oats. The diagnosis may be small cell lung cancer. Using cell surface markers, a patient will be diagnosed with one of the 3 subtypes of non-small cell lung cancer: adenocarcinoma, squamous cell carcinoma, or large cell carcinoma. Right now, we don't know what kind of lung cancer Andre Braugher had, but we do know that it progressed pretty rapidly. Fact number 2, lung cancer cells metastasize. This means that cancerous cells in the lung can migrate to different parts of the body. Lung cancer can spread in several ways. They can grow into nearby healthy tissue. This is known as local metastasis. Cancerous cells can also invade lymph nodes and travel through the lymphatic system, or they can invade and spread through blood vessels, and that's known as vascular invasion. These are known as distant mets. While they can spread anywhere, lung cancer most commonly metastasizes to the liver, brain, bones, lymph nodes, or adrenal glands. Metastatic lung cancer is considered late stage, aggressive, and treatment options are limited by this point. Fact number 3, tobacco is the #1 risk factor for lung cancer. About 80% of lung cancer deaths are thought to result from smoking, and this number is likely even higher for small cell lung cancer. The longer you smoke and the more packs per day you smoke, the greater your risk of lung cancer. Each cigarette has nearly 600 toxins, including 60 known carcinogens or cancer-causing chemicals. Cigar and pipe smoking are just as likely as cigarettes to cause lung cancer. Vaping has also been associated with lung cancer. It's also important to remember that secondhand smoke, which is the smoke of others, can also increase your risk of developing lung cancer. But the good news is that once you stop smoking, the risk is drastically reduced. Nicotine replacement therapy and counseling can be very effective at helping people quit smoking. Other risk factors for lung cancer include exposure to asbestos and radon, arsenic in drinking water, air pollution, and family history. Fact number 4, various treatment options exist. Treatment depends on the type of lung cancer. Non-small lung cancer can be treated with surgery, radiofrequency ablation, radiation therapy, chemotherapy, targeted drug therapy, immunotherapy, laser therapy, photodynamic therapy, cryosurgery, and palliative procedures. Small cell lung cancer has fewer treatment options, namely surgery, chemotherapy, radiation therapy, immunotherapy, laser therapy, and endoscopic stent placement. Always ask questions and share your concerns with the cancer care team. The good news is that survival has increased for lung cancer over the past several years. Fact number 5. Health disparities exist for certain people with lung cancer. Did you know that people of color who are diagnosed with lung cancer face worse health outcomes than white Americans? Why is this? In part, people of color are less likely to be screened, therefore less likely to be diagnosed, and less likely to receive treatment. In addition, nearly half of the 30 million uninsured Americans are people of color, and data clearly shows that health coverage impacts health outcomes. Lastly, expression of pro-inflammatory genes may be increased by negative social stressors such as structural racism and discrimination. Addressing disparities in lung cancer screening, diagnosis, and treatment is critical for the overall health and well-being of people of color. So how can you make a difference? You can learn more, volunteer with, or donate to organizations such as American Cancer Society, Longevity, the American Lung Association, and Stand Up to Cancer's Health Equity Initiative. You can also contact members of Congress to co-sponsor HR 4286, which will improve access to and raise awareness for lung cancer screening for those at high risk. Well, that's all for today. Here's your joke of the day, lung themed. What did the right lung say to the left lung? We belong together. Be sure to subscribe to my YouTube channel, write comments below, and follow my Instagram at Health Humor Harmony Dr. Roy. Be well, and I'll see you soon.